to Live at 9. I'm here with Wendy Bailey and with the Department of Mental Health, and we're talking about something called Stand Up Mississippi. Can you just tell me what that is all about?
Yes, so Stand Up Mississippi is a campaign that was created. The Department of Mental Health started it a few years ago, and we've got a lot of other partners across the state, and it is to bring awareness to end the opioid crisis in the state of Mississippi.
Wow.
We know that there's one death every 5 minutes in the United States from a drug overdose. And in Mississippi, we lost almost 400 people in 2023 from drug overdoses. And about 76% of those were from an opioid.
Wow.
So this campaign is to bring awareness and education to opioid misuse and abuse, and also the importance of recovery and receiving treatment.
Absolutely. I mean, that's heartbreaking, that statistic right there. And so I think the importance of bringing the awareness, so I'm sure many people don't know how common that is. So how important is the awareness side of this campaign?
Well, if you think about it, many times an opioid dependency can start with a simple prescription. You may have an injury and you need pain medication, and even a short-term use of pain medication can sometimes lead to dependence.
Right.
So that is a big part of the awareness, is for people to understand, to look at other pain alternatives, if possible, pain management alternatives. But if not, just to be very aware of the use and to only use what has been prescribed to you and not over that amount, and as short term as possible, because many times that does lead to that dependence very quickly. We also know with the young adults in our state, there's a lot of inappropriate use of opioids, and fentanyl has also been on the rise, and fentanyl is extremely deadly. So the education piece of knowing what opioids are and how to avoid misuse, but then most importantly, if you do find yourself dependent upon an opioid or misusing it, that you know that recovery is possible and that treatment is available.
Right, and even if you're not the one dealing with that addiction, how, as a family member or friend or someone in your circle of life, how can you look out for that for other people? Because losing someone like that, especially in a sudden way, I mean, that's really tough. So how do you take proactive measures?
So one of the most important things is, I think, that we understand as a society and then in our families, that a substance use disorder or an addiction is a disease. It is not a moral failing.
Right.
It is not because you're not strong enough to overcome it.
Right.
It is a disease. And as with any other disease, you need treatment and help to overcome that. And for family members and loved ones and communities to just rally around someone and understand, if they broke their arm or if they had diabetes or if they had cancer, you would support them in getting the help that they need. And it's the same way with an addiction.
Exactly.
Having that open conversation with your loved ones to where they know they can talk to you and not be judged, but be supported and get that connection to treatment.
Awesome. Okay, and what does that road to recovery look like? And what are y'all trying to, I guess, bring awareness when it comes to the recovery side of things?
I'm so glad you asked that question. The road to recovery we always refer to is non-linear. It is not just a constant step up. There's going to be step backs sometimes along the way, and there may be somebody who needs to be in treatment multiple times or have residential inpatient treatment and outpatient treatment after. It's not the same for anyone. It's very individualized and person-centered. We had a crisis training yesterday and had an individual who's a peer support specialist in the state share his recovery story and how long it took him to get to that point.
Wow.
But there are more than 600 residential treatment beds available across the state of Mississippi with providers. So the treatment is there and it's available for people who need it.
You just need to seek that.
That's right, and that goes back to our Stand Up campaign. So www.standupms.org, you can have a treatment locator, so you can find where you live in the state and what providers providers are in your area to get the treatment that you need.
And that is so crucial. So I really appreciate that. I mean, I think everyone can probably think of someone they know of impacted by this crisis, and hopefully we can, with the Stand Up campaign, just make such a big difference and save some lives in the process.
The other way that we can save lives is through the prevention piece. So we distribute naloxone, which is a nasal spray that reduces the effects of an opioid overdose. Doesn't replace medical care. You still have to get to a hospital, but it saves lives, and we distributed more than 6,000 doses last year.
Wow.
So you also can find out on that site how to receive Narcan.
Okay, yes, super crucial information there.
Yes.
So thank you so much, Wendy. I really appreciate it.
Thank you.